This is a presentation on Tourette's syndrome. So what is Tourette's syndrome? Tourette's is a neuropsychiatric disorder causing intermittent involuntary muscle movements or vocal outbursts called tics. The pathophysiology is unknown. Theories about the pathophysiology generally point to genetics. It is also believed to be unbalanced chemicals in the brain such as dopamine and serotonin. Dysfunctions in synapses in the brain with neurotransmitters are the main cause of tics. The disease presentation, the hallmark of the disease is motor and vocal tics that are chronic. Tics have two categories ranging from simple to severe. An example of a simple tic would be nodding the head. An example of a severe tic would be nodding the head, blinking the eyes, clapping the hands while yelling all at the same time. Tics may have what are called waxing and waning periods, which means they may worsen and can get better periodically. Tests, procedures, and diagnosis. There is no one specific test used to diagnose Tourette's. Usually, a history and physical examination are used to rule out other health problems that might be causing symptoms. MRI, CT scan, and blood work might be done to rule out other disease processes. The disease, like I said before, is believed to have a genetic link, and the exact cause is unknown. So here's an example of a normal brain and then a brain of a person with Tourette's. You can see that the brain of the person with Tourette's is very overactive with all the red areas in the brain. Disease duration and progression. Symptoms may be seen in infancy with Tourette's syndrome, but the onset is usually by age 7 when symptoms get the most severe. It is more common in males than females. Usually symptoms resolve in most, but not all patients by adulthood. Symptoms may worsen during puberty due to changing hormones in the body and self-consciousness about tics. Usually anxiety worsens tics, especially around the time of puberty and adolescence where people are already kind of self-conscious. Outcomes and expectations. People with Tourette's can live a fairly normal life with the right management. It's not a death sentence. People do not die from Tourette's, so most patients have a good prognosis or expected outcome. The most serious complications are usually due to comorbid conditions such as anxiety, obsessive compulsive disorder, or depression, which can all come with Tourette's syndrome. These are seen more often in more complicated cases versus mild instances. Usually, Tourette's does not require hospitalization. Patient-centered education. Usually, you can refer your patients to a Tourette's support group, such as the Tourette's Association of America. Maybe you could also refer them to parenting skills classes or social skills groups. You also want to educate parents on Tourette's syndrome and explain the importance of being non-judgmental towards the tics and the correct ways to manage disabling or inappropriate tics. Proper use of medications is very important. Taking your medication, the right dose, the right time, the right med. Some treatments that may be used for Tourette's syndrome are behavioral therapy, counseling, medications such as alpha-2 adrenergic like clonidine or guanfacine. You might also use D2 dopamine receptor drugs. Various other medications might be used to treat comorbid conditions, like I said, such as OCD, ADHD, or depression. Surgical cases are usually very rare. You might use deep brain stimulation, but that is in rare cases. Okay, so NCLEX questions. Which is the drug of choice for treating Tourette's syndrome? A, fluoxetine, B, fluvoxamine, aka Luvox, C, haloperidol or Halidol, D, paroxetine or Paxil. The answer is Halidol, and the rationale is Halidol is the drug of choice for treating Tourette's syndrome. Prozac, Luvox, and Paxil are antidepressants and aren't used to treat Tourette's syndrome. Another NCLEX question could be, all of the following are true about Tourette's syndrome except A. Drug treatment completely eliminates symptoms. B. It is involuntary and may be a chronic condition. C. Symptoms are generally most severe during adolescence. D. Symptoms are generally detected in children. The answer is B, C, and D. Drug treatment may alleviate but not completely eliminate symptoms of Tourette's.